Welcome back to my channel. Today we are discussing a critical health issue that many may not realize affects their dental health: the connection between acid reflux and cavities. If you're someone you know deals with acid reflux or cavities, this information could be quite enlightening. To start, let's briefly define acid reflux. It occurs when stomach acid flows back into the esophagus, often resulting in a burning sensation in the chest or throat. This condition can significantly impact your overall health, including your oral health. Having experienced acid reflux for several years, I understand how uncomfortable it can be. It can drain your energy and lead to digestive discomfort. During that time, I was surprised to learn that I developed more than a dozen cavities. Acid reflux and indigestion not only affect your daily life but also can lead to serious dental issues. So, how exactly does acid reflux impact dental health? When stomach acid comes into contact with your teeth, it can create an environment that erodes the enamel. Over time, this erosion can result in tooth decay, increased sensitivity, and even gum disease. Let's break down the specific effects. Enamel erosion. The protective layer on your teeth weakens, making them more vulnerable to decay. And the next one is tooth sensitivity. As enamel wears away, you may experience discomfort with hot or cold foods. Gum disease. The acid can irritate the gums, leading to inflammation and increased risk of infection. Now that we understand the potential dental implication of acid reflux, let's discuss ways to protect your teeth if you have GERD. Brush your teeth regularly. Brush after every meal and before bed using fluoride toothpaste. 2. Floss daily. This practice helps remove plaque and food particles between your teeth. Use antibacterial mouthwash. Incorporating this into your daily routine can help maintain oral hygiene. Limit sugary and acidic foods. This can aggravate acid reflux symptoms. Number 5. Schedule regular dental checkups. Be sure to inform your dentist about your acid reflux history so they can monitor any potential damage. When I struggled with digestive issues like acid reflux during my teenage years, I experienced numerous cavities. Looking back, I wish I had prioritized my diet and oral health more. It is a reminder that what we eat and how we care for our teeth can have a lasting effect on our overall well-being. So, maintaining your dental health is essential, especially when managing acid reflux. If you found this video informative, please give it a thumbs up, subscribe, and share it with others who may benefit from this knowledge. Thank you for watching, and remember to take your health seriously.